Drug shortage.
Empty store shelves.
Sorry, we can't fill your prescription.
That medication is on back order.
The problem has become so rampant, people are creating memes.
Pharmacy staff can go to Etsy and buy badge
Reels that make light of the situation. And who can blame them? It's frustrating for the care team, just like it is for the patients. The FDA publishes a list of medications that are in shortage. The problem is, it's supposedly mandated that drug manufacturers report the shortages, but there are no repercussions and no penalties for not reporting. And as a result, many more drugs are in shortage than are being reported to the FDA. What types of drugs are currently in shortage? Chemotherapy drugs to treat cancer, drugs that prevent heart attacks, treat heart disease, and strokes. Drugs to help people breathe. Antibiotics. Medications that treat coughs, colds, and even the flu. Pain medications. Medication for ADHD in adults and in children. Even sterile saline is on the FDA list, and not just the kind that goes in your IV, the sterile solution for wound care and the inhalation solution for asthma and COPD sufferers. What causes these shortages? There are a number of factors involved. The easy answer is government regulations or Medicare and Medicaid rules. But the real answer? Generic drugs make up 90% of the prescriptions sold in the United States. There's simply no money to be made in generics. Many factories have either scaled back production or closed completely because they can't afford to keep making the medications. Medicare and Medicaid formularies often prefer brand name medications as opposed to available generic. If Medicare and Medicaid alone would add generic medications to their formularies in place of expensive brand name drugs, they might make it lucrative enough for generic manufacturers to stay in business. If the FDA had the authority to punish companies for failing to report shortages, it might encourage those companies to do a little better. But in the end, corporations want to protect the bottom line at the expense of public health. So where does this leave us? It leaves us with the real pain. Drug shortages hurt.